Thanks for joining us, everyone. See, there's a lot of people joining us here on the webinar, and we have some other people joining us over on Zoom or on, Facebook Live. So very exciting. I'm very excited to present this topic tonight. We have two amazing experts with us that are going to talk about all the different perspectives that go into the LGBTQ plus health. So very excited to start. I think we should get going. So I'd like to introduce you to Dr. Patel, and she will be talking about, sorry, I gotta get my glasses on. She will be talking about some different things that have to do with LGBTQ plus health, talking about how to talk to your provider. And if we could go to the next slide. Dr. Patel has a degree in psychology. She is a licensed clinical psychologist. She's been practicing for almost 20 years in the state of California. She has been doing cognitive behavioral therapy, acceptance and commitment therapy, and dialectical behavioral therapy. Strong interest in life transitional issues, interpersonal conflict, eating disorders, grief and loss, and trauma. We're so excited that Dr. Patel is joining us tonight because she has a very in-depth knowledge of this subject. So Dr. Patel, do you want to take it away?
Thank you so much, Carrie. And it's wonderful to be a part of an organization that is trying to shed light and open the conversation up on something that's very important, such as this topic. So obviously, when you start a topic like this, you usually have to go through some research and some statistics before you get to what I call to be the heart of the subject matter. So bear with me as we go through this. And some of this information that you're going to see in the next couple of slides may come across as, well, we already know that, but it's always a good reminder for us to level set things like this when we're talking about something as important and also sensitive as the subject matter. So, the reality is that somebody's sexual orientation, their gender identity, who they decide to fall in love with, how they embrace their body or want to live happily in their body is something that really doesn't fall under any kind of category. It doesn't stay colored within the lines, right? It's often blurry and it's often crossing the lines. And so I think one of the things I love to just mention is that, individuals who live in and are a part of the LGBTQ plus community come from all walks of life. And as a result, obviously have, historical information, whether it's life experiences, cultural, religious, ethnic, racial influences that impact the journey that they go through, whether it is somebody who is, coming out now or has had a history of it, or potentially is realizing that they want to live a different kind of lifestyle, a different kind of life. It doesn't matter. It crosses everything. And I think that plays a huge role with what we know are potentially the reasons why there's a lot of health disparity, in particular with this patient population, or this population. Sorry, I work in healthcare, so a lot of times you might hear me say patient, so I'll try really hard not to use that terminology. It's like a second language for me. And then I think the other piece is to recognize, similar to other groups out there who have what we know in mental and healthcare space, a presence of health disparity, is the fact that there is historical, social, situations, oppression that has played a huge role in why they choose not to potentially get the support and the help that they need. And so, of course, we know that there's a lot of research out there that indicates that individuals from the LGBTQ plus population and individuals who live end up having to face things that are unnecessary based on, discrimination that they've experienced, whether it's within their own internal self. You'll hear me talk a little bit about the different kinds of discrimination and stigma that exists, or it's within their own family or friend circle or the society at large. and how much that plays a role in impacting whether or not they seek out the support that they want and they get the support that they need. And those are two separate things that I think fall under the category of health disparities. The other piece I humbly want to acknowledge right now, especially the fact because we are still in the pandemic and experience this even just in other groups, but definitely see it higher and more so in the LGBTQ plus population, is the fact that they also might be denied certain kinds of rights that they have, being a human, being a civilian, here in the United States or even across the world, and how much that does impact their journey when it comes to mental and medical care, and not having that, the civil rights that they deserve be in place. And I think we've experienced a lot of that in this last, 22 months, where just at large, individuals have not had partners in the room when things are happening that are significant, whether it's a medical issue that they're getting treated for, even like a birth of a child, and how much that is even exasperated more so because somebody might identify as coming from the LGBTQ plus population or community. And as a result of potentially having that years of experience of discrimination, or whether it's external from other people or internal from themselves, or feeling that stigma, obviously it's just something that's you're going to see an increase in mental health conditions, increase in substance abuse, and unfortunately also an increase in suicide or suicidal attempts. Next slide. So we do know, taking strides to figure out, one, what are those barriers? Because you can't eliminate something if you don't truly understand and figure out what those barriers are. And then secondly, strive to figure out how to eliminate, the things that are creating those health disparities, especially with this population. That is going to be a way that we can continue to support individuals, having a healthy, purposeful, driven, fulfilling life. And the key part about this slide that I really want to highlight is the fact that it does take a village to figure out what those barriers are. And it does take a village to figure out ways to eliminate those barriers. And to have it be that it's not just certain people in the village that are going to be successful in doing it. I think it's something that, being in healthcare myself, being in mental health space now for almost 20 years, I continue to see how it's always going to be important to find people who have the passion and desire, and also the humility behind recognizing that you will have to work diligently and hard to make sure every rock is turned over to see whether or not you have identified all the barriers before you say you've successfully eliminated something. And I really wanted to highlight that particular part about this section. We understand that there's going to hopefully be obviously long-term benefits and short-term and long-term benefits for striving to figure out what those, health disparities are, and ways that we can hopefully improve them and remove them, because we know that it is going to create just a better health experience for LGBTQ community members. Next slide. So why is this important? I mean, I think the biggest thing is the fact that, similar to other, communities and populations who have a very, a similar, if not identical, but similar experience, is that as a result of having these health disparities, individuals from the LGBTQ plus community, unfortunately, then end up having some pretty negative impacts to their daily lives. So what we hope to see and accomplish, if we were to able to correctly identify those barriers and take the steps to really impact them, reduce them, or even eliminate them, would be these areas, right? That we would see a reduction in disease transmission and progression. I'm going to stop there real quick and talk a little bit more about that. And that is that we recognize that individuals who, come from this particular community may not always feel comfortable to seek out the care. And the care I want to highlight specifically is preventative care. we know in our healthcare system in the United States, preventative care isn't something that is always at the forefront of both insurance companies, insurance plans, healthcare systems. But even more so with this particular population, there's truly a fear and a recognized fear amongst providers such as myself that individuals may not then seek out the care at a timelier manner that they could have had, or they should have had, or hopefully would have gotten to had they felt comfortable enough to go and find the provider and or recognize that they might need that support and that medical care, the mental health care. And so as a result, there could be a potential of themselves experiencing conditions that could have been prevented, or potentially having a condition that was transmitted to somebody else that hopefully we knew that we could have helped them out earlier on with preventative care. And so we definitely wanted to strive to figure out ways to reduce the health disparities so that these individuals do feel comfortable enough to get the care earlier in advance, versus when it gets to a place that it's so acute or inundating to their lives that they, it's something that is no longer preventable. Secondly, obviously, mental health. I mean, being a psychologist myself, I can't even emphasize the fact that, we do live in a world of crisis, that we do. And I believe it even came out, even highlighted more in the pandemic, how much there is such a strong mental health need for most humans out there, but obviously in particular, with the LGBTQ plus community. And that is that if you think about the things that in any human's life that can impact them, relationships, their own sense of self or identity, dealing with family issues, trying to figure out their purpose or what they hope is going to bring them happiness in their life, or professions or schools, just highlighting just like the sense of relationship they have with themselves and others, how they think the world perceives them. All those things, like any human being can go through and struggle with. But if you have other layers of your life, or even inability to trust human beings because of your experiences that you go through, it is natural and normal for your mental health to be impacted by it. And so, of course, we know that if health disparities is something that prevents somebody from getting the care that they need at the time they need it, even more so, we want to strive to remove those barriers so that individuals from the LGBTQ plus community feel comfortable enough to get the care, and more importantly, know who they can turn to. And I know we'll talk about that later on today. And the other thing is that we know that there are several groups of individuals out there that, as a result of those social determinants of health, they end up having a shorter lifespan. And add on to that, somebody who lives with mental health issues, especially chronic mental health issues, we know that lifespan potentially could be cut by 25 years. And so it's just something I want to highlight again, that, that internal happiness that somebody strives to have, especially when you've been faced with such oppression as this, particular community, is really important for living a long and happy and healthy life. And so, of course, if we're able to address these disparities, we do hope that ultimately the lifespan of these individuals will flourish and will be, as long as they hopefully can be with us. Next slide.
So Dr. Patel, I'm just going to jump in here for a moment. Sorry. So you're talking about it from the LGBTQ perspective and mental health and COVID. And obviously the pandemic has affected so many of the affected so many of the minority populations. And Monica, I know that you deal a lot with the Hispanic population. So can you tell us, is there a similarity happening there in the underserved populations and how COVID has affected them?
I mean, I think one of the things is to remember that so I'm Indian myself as well. And I think one of the things that was a challenge for a lot of, minority individuals or minority groups was we live in a world where our definition of family is very different. And so I remembered hearing that quite a bit, that it was hard. Like most people who ended up sort of figuring out where to be, especially when we were locked down and we were secluded in our homes or in our neighborhoods or in our community, we didn't have a lot of individuals don't have a full family in their home. And I think especially on in relation to the LGBTQ plus community, I mean, the definition of family is completely non-traditional. And in a world that we're trying to shove people into a tradition of, at least you're okay because you're in your home, you have your partner, you have your kids, you have your pets, you have your plants, you have maybe your grandma, whoever. That's great, but that it was a very unfortunately a very narrow-minded perspective. And I think for me also, as I represented myself, one of the things I will share is, I am single, and I think that even added more to it. But like I had that empathy, let me just put it that way. I had the empathy to understand that there was an assumption of what the sort of the traditional idea of what family in your life would be like carried over, and or if you were somebody who necessarily had a bunch of friends, it was quite easy to just figure out a way to like socialize with them. But it wasn't. I mean, there was you may not, I was having to remind individuals that physical isolation did not always mean social or emotional isolation, and then helping them figure out, well, how do you achieve that emotional, social connectivity, even if you weren't necessarily in that presence. But doing so in a way that you at least acknowledged and validated, it was still lonely. It was still challenging because you may not have had that traditional perspective that, was put there.
So Monica tried to jump in there, sorry. And Monica, you're on mute.
So, no, I was
Hispanic
just
Latino perspective, I think it's almost the opposite, right? Like there was maybe a lot of people living in your house and you were not able to get out of the house. Like it was almost the opposite phenomenon is what I have heard from my friends. So what is your perspective there with the pandemic?
I think in a lot of communities of color, but just like also in Latino communities, it's a very collective culture. So I feel like I'm on board with a lot of the things Dr. Patel had said, that you have multiple generations living in one household, like grandparents or like godparents or, tias, tios, uncles. And so, yeah, it's very difficult to separate like oneself from the family because cultures are so collective in nature. And so I think that was like one of the larger issues I'd seen across the pandemic, where it really highlights how like the differences, where I think a lot of folks have a very like individualistic mentality where there's maybe less of a fear with COVID and the pandemic because they think about their own health, and it's very hard to see past a lot of those privileges because they may have better access to care, or it's just like, oh, well, I haven't gotten sick. But there's a dire need to really think of like the pandemic on more of like a collective state, where we not only consider our own health, but our families, and the fact that, yeah, like so many folks have multiple generations of families like living in one household, and how much of a larger risk that poses, and that we just have to be more considerate of our care, because we may be putting other folks that are vulnerable at risk if we're not taking those precautions. So I relate to a lot of what she was sharing.
Thanks. Dr. Patel, feel free to continue. Just want to jump in there a little bit.
No, of course. Thank you. I mean, I think that was a really important piece, and it sort of does tie into, just this idea that, as I mentioned, the definition of family is definitely a key thing here, right? And I think of when, somebody who is from the LGBTQ plus community, and they go through something, medically or even mental health wise, that impacts themselves, they may not have that traditional familial support that others have. And they might not have somebody who may necessarily, like we think of traditionally, would be somebody who identifies like, hey, maybe I can help you, I can take you there, I can help, do whatever the case may be. And I think that's something to be sensitive about, especially as in the healthcare system. I will put I'll call them out on this, that sometimes you may not necessarily understand, because it's not a traditional title that person has in this individual's life. But to understand that must mean that you need to then be curious about, well, what is it about this person that they're bringing them in to the treatment and whatnot. And I understand that, this is something that I do hope in time, when it comes to bringing the right people in, if you needed that support, or even somebody who you need to have as your emergency contact, or things of that nature, that how do we decide and how do we support and encourage individuals to feel safe enough to say, this is the person who is going to be my person. I happen to come from a family that we have a very strong belief that if anybody, whether it's in our family or even friends, like for example, my neighbor one time during COVID was having to go into the hospital, and we have a very strong philosophy in my family. And that is that if somebody's in the hospital for surgery, you sit there the whole time, no matter what, you sit there. And I think about, some of my friends, some of my family members, and I think about, what did they face? What did they lived in the situation where they couldn't bring that person in because the healthcare system and the hospital says, no, there's not a family member. And it's like, where do we strive to push that conversation to say we need to expand the definition, so that those individuals have the support that they need, and they're heard to know that person is going to be in that room. And that is it in my family, in our culture, it's this idea that you have that energy in the hospital with you when you're going through something difficult. I would say the same thing for anybody. Anybody should have whoever they want in there, but in particular with, we know this, that there has been history in the healthcare systems where, some hospitals are still struggling to be able to get their partner in, let's say, if they're getting some kind of procedure done or whatnot. Anyways, we can move to the next slide. So, I think we've been sprinkling this throughout the conversation so far as to what are some reasons why discrimination continues to happen, especially with this particular community. I definitely highlighted this a lot in terms of what exactly is there in the healthcare insurance in the healthcare systems, in particular when it comes to who's allowed. If you may not be legally married in the state you're in, but that person has been somebody you've been with for 20, 30 years, and what kind of access do they have to support you? When it comes to, when it comes to your healthcare, or getting the treatment that you need. We unfortunately still have yet to have really significant, I think, legal support in place to help remove the things that are obviously negatively impacting, LGBTQ person's life. And that is bullying, let's say in school, or bullying, let's say at work, or, bullying in terms of trying to buy a house or to rent an apartment, or to adopt a child, those things. And I use that word bullying very kind of specifically, because I think I think of bullying as somebody as a large entity bullying, or large person, quote unquote, bullying a small person, quote unquote. And if you think about it, that's something that is obviously an experience with when large systems are not allowing individuals or groups of individuals to be successful and happy and thriving and find purpose and meaning in their life. If you think about what's in the first bullet, all those things fall into that category, right? If you think of somebody who is in good health, has insurance, has a fulfilling job, has a roof over their head, is in a loving relationship, is able to have a child or adopt somebody, and is able to live life when they finally stop working, and it's being affected by a large system that doesn't necessarily allow them to do those things. That's how I define bullying. We also know that, and this is something I think of when we talked about the pandemic, we unfortunately, we still need to close the gap. And the gap, what I'm talking about is that it's not just formal care, right, that people can go through. I mean, we noticed in the pandemic that the usage of telesupport, whether it's teletherapy, telehealth, texting, support groups, things like that, all that came into like a heightened presence during the pandemic, and it clearly is not going to go anywhere. But I want to recognize and highlight that we still are missing the mark when it comes to creating those social programs for, the TAY age, transitional age youth that might be leaving their homes because they're not accepted anymore, and identifying themselves as, coming out for the first time, or, somebody who is elderly, who is still trying to transition their life and figure out what support that they need, and they don't have the right people in their corner. So definitely. And then the last piece I'm just going to quickly highlight is, and I know I'm going to go into a little more detail later, is that I want to challenge what we consider to be cultural competency. And so let's keep going, and I'll work on that statement a little bit more. Sorry, next slide. I think I'm okay to skip this slide. So let's go on to the next slide, because I want to talk about finding the mental health providers, or sorry, the LGBTQ plus providers. Okay, so one more slide, I think. Wonderful. Well, stats are significant, as I mentioned. I mean, just to recognize that 1 in 5 lesbian, gay, and bisexual patients report that it was their sexual orientation that was a factor that delayed them receiving healthcare. Obviously, we know that's going to be even heightened with somebody who is, in trans or gender non-conforming community as well. And then add a second layer of that, if there's somebody who, comes from an ethnic population that has even its own, level of oppression. And because of that feeling of uncomfortability, somebody may not want to seek out the care that they fully need, and obviously share the stuff that they really need to share in order for them to get the right care that they need. So next slide. I do want to just highlight here, and I'm hopeful these slides and this particular content in this slide has been shared with you all, in terms of just, what we see to be trusted online resources. And if you see amongst this group, like some of the content here has a lot to do, if you want to just even get knowledge. So education is very important, and I'm going to talk a little bit about that. And then also resources, and even, provider care. But I think one thing as a mental health provider myself that I will say is significant and important is, if you find a resource that you yourself are very passionate about, and it speaks to you, and it speaks the words that maybe you may not, you're not comfortable enough to share yet, I think it is I would like to think it could be well received if you refer to your provider to these sites as well, and that you share with them, listen, I've been able to myself get a little bit more understanding of just the things that I want to share with you about, my sexual orientation that impacts my physical health, or my sexual orientation that impacts my mental health. Could you spend some time reviewing this site? Or if you have specific content from the site, just to share it with them. The biggest message I hope I send today is, you are the driver of your care, nobody else. And so I hope that allows you permission to share the information that you want to share. And if it's not received, that's information, that's evidence for you to support that maybe this isn't the person for you, and you need to go out and seek the care that you need to go get from a provider who actually listens to you and takes that feedback in. Next slide. So I'm going to spend a lot of time on this slide. So, okay, first and foremost, I think some of the best providers I've ever met, whether it's for my own care or through conferences or colleagues, or even just word of mouth hearing from people, are not going to be those professionals who know everything about your life. Because guess what? Or the things that make you up. Because guess what? Most likely they don't exist. So the thing I encourage you to look to, and these are very important tips, and I actually wrote an article about how do you go about starting therapy because of knowing I've heard this over and over again with people just don't know what to do. And so I think the first and foremost question for you to ask yourself, and again, I am a mental health professional, so for me the key thing is, and I think it relates to physical health care too. What is the reason why at this moment you're choosing to go get that care? And then backpedal to find somebody who's going to help you out with that. They may not necessarily identify as, coming from the LGBTQ plus community. They may not identify as coming from the same culture or religion as you. They may not identify as coming from the same socioeconomic background or even town. They could be in the same state you live in, but not necessarily the same town. And they may not even be on your insurance. And I don't want any of those to be reasons why you check somebody off to say, okay, next, right? This isn't like the Grinder and the Bumbles of the world, right? We're talking about your own healthcare. And the thing I ask for you to consider and keep yourself open to is finding somebody who can have acceptance and compassion towards you, and do that by demonstrating empathy in a way of, let me hear your story. How would you want me to address this about your life or that about your life? What are some things that you would want me to go look into so I'm a better informed individual sitting across from you in session? What are things that are important for you for me to hear? And again, it doesn't have to necessarily, like, they don't have to have the same life experiences as you, because quite frankly, I don't have all the life experiences for the people I've seen in the last 20 years of my life. But the thing I will humbly say is I try not to have that chip on my shoulder that I do. And instead, it is to open the door and say, how can I best be a good listener and a good supporter and a good cheerleader for you? And how can we discuss? And in so much as, how do we discuss if something happens in that session or in that therapeutic relationship or that medical provider relationship that doesn't sit well with you? How do you and your provider create that conversation, that language that you both mutually agree upon to say, I needed you to hear this part of it, or I need you to hear that part of it? And I say this as a woman who is in mental health herself, and I've seen it happen where, individuals, unfortunately, even in front of me, will say something, me being the patient, and will say something to me, and I'm like, wait a second, that didn't sit well with me. And having to speak up for myself and say, listen, I didn't really, that just didn't sit well with me. And if you're willing to listen, I'd like to share with you my experience and find a way that we can still continue to work together. I encourage you to take this into consideration when you're looking for a medical provider or a mental health provider, only because I'm never going to lie to people and say you're going to find a provider that's perfect for you on your insurance panel or in your neighborhood or whatever. And that is, forget all the other reasons why somebody might struggle to get access to care. That is the first and foremost reason people struggle to find access, is because of thinking that that they're going to have to find that perfect person, and the person doesn't exist. And so I'd rather empower each of you out there to find ways to at least find the right person for you, because that right person for you is somebody who's at least willing to learn and listen and support you and mirror for you the relationship dynamics that you're going to experience outside. That is something that's also important in terms of therapy. Your relationship with your therapist is a reflection, most likely, of relationships with others in your life. And so if you and your dynamic with your relationship with your therapist learn ways to challenge yourself and to deal with challenging conversations and to resolve conflicts, it is a great way for you to mirror that outside your life. If you find somebody who is so validating and exactly like you may not actually end up having those challenges present to yourself in therapy. And it may not be as fruitful and a growth opportunity that it could be if you go and find somebody who, you know, is going to push you. Like I said, remember, we're not coloring within the lines, we're coloring outside the lines here. And I just want to make sure that that's highlighted. Going back to this slide. I trust people. I encourage people to not just, so for example, Psychology Today. Please don't go look at Psychology Today. Feel free to go look at the state that you live in, their websites that support and say if this person's licensed and what their license is. Please go see their provider, the actual provider website itself. See what kind of language they use. See what kind of images they use. You know, see whether or not they've published before. A lot of us have written blogs or articles, and our websites contain links to them. Look at the tone as to how they write their content. Is it welcoming? Is it inclusive? Is it kind? Is it warm? Does it speak to people of all walks of life, or does it talk down to them? Just things like that. A lot of providers are willing to let you do a 15-minute check-in, whether it's on a video or a phone call, especially with the pandemic, and especially because a lot of us do telehealth now. So certainly consider asking for it. And if it's not listed on their website, when you email them or call them, ask for it and see if they're willing to do it. As much as possible, try to find reviews. There's not many, but if you're lucky enough to find them, definitely take that into consideration. And then some places, you know, especially if it's a group practice of some sort, they might have a front desk. Again, notice how the other team members are. It's one thing also if you're going to a group practice that the providers are one way with you, but remember, if you're going to be walking into an office or experiencing the other administrative staff, make sure they're warm and welcoming too, because that to me means that the provider is considerate of not just their performance, but that whole wraparound care that you're getting when you walk into an office. Next slide. Again, just, you know, some key things to look at is whether or not they do have a non-discrimination policy. You could even potentially ask them if they go get continuing education in the area that you're trying to get support on or treatment in, or if you are wanting them to have experience working with diverse populations, definitely ask about whether or not they've gotten, you know, continuing educations in that as well. Especially when you're going to a provider clinic or office or a large, you know, building, do they support gender neutral bathrooms? You know, I know a lot of the different states have definitely challenged the policies to ensure that is the case. And certainly something for you to have a, you know, a right to go ask for or to go look for it, especially if it's a large building that you're going into. And like I said, also, you know, what is the makeup of the people who work there as team members too, because you want to make sure that they are definitely inclusive and respectful as well, not just the providers. Next slide. I can't even emphasize enough about the trust your instinct. And I think that goes back to that slide a couple of minutes ago, just discussing about how they may not necessarily check off on all the criteria you need, but if your instincts says when you're talking to them on the phone or doing a video call with them, that you feel seen, you feel heard, and you walked away at least knowing that there's a possibility that you would be able to get a different perspective in the situation that you're trying to get support and help with. Trust your gut and your instinct. And if it's saying, you know, this person might actually be there to listen, you can stay with them and try it out. And ultimately the choice is yours for both your healthcare and your mental health care. The choice is yours. You don't have to stay with somebody if they just don't hear you, or if there's something that is just not resolvable. And certainly you have every right to say, this isn't working for me. I need to go find somebody who meets me where I need them to meet me at. And that is your fundamental right, no matter what. Next slide. And with that, I'll pass it back to Carrie.
Thank you so much, Dr. Patel. That was amazing information. I have a lot of questions rolling around in my own head, but I'm gonna think it over as Monica takes over for this next presentation. So Monica is with us from Chicanos por la Causa. She's been 5 years as a facilitator of their wellness program there and their teen outreach program, serving on an average of 150 youth per school year. I should put my glasses on because I can't read. She has a background in Mexican American studies. And Monica, yes, you went to University of Arizona, correct? In the College of Education. Well, so we have a similar background there. So take it away, Monica.
Hi, all. So thank you so much for having me in this space. So I by no means don't consider myself an expert. I'm also in the learning process, and I'll speak from my experiences in doing community work and and then just the time that I've spent working within a lot of the local high schools here in Tucson. And I really want to sit with first like the cultural competency piece. I personally don't really go by that term, and in the circles in community that I've been with, I've really looked at it from like cultural humility standpoint, where I believe that like it's a continuous process where we're taking in information, and it really goes beyond like pamphlets or like brochures that we have, but really looking at the ways in which like we're showing up for marginalized communities. And something that I've learned is really centering those that are within the margins of the margin. So meaning within the LGBT community that like we're speaking of, like really looking at those who have like multiple identities that they're navigating. So like trans women of color, I think of queer youth of color. And something that's really spoken to me is in doing this youth work is like really looking at like power dynamics that exist. And so for me as an adult, like organizing in like youth spaces, I always make it a point to like communicate that to like our youth and our families, and that they really come to you with a lot of trust and a lot of vulnerability. And so being conscious of that and really looking at the ways in which we're listening to what they're saying and really trying to validate those experiences. And I know a lot of the slides are like talking about like statistics and just a lot of those disparities that exist, and just reminding ourselves that like at the end of the day, like we're dealing with human lives here, and there's like a sense of urgency because of the violence and like trauma that's experienced. So and so a lot of my knowledge and the way that my team and I approach our work is like just really thinking about the community that we're residing in here in Tucson. And so I think of, like the families that we're serving here are predominantly Latinos, but also like the 22 like federally recognized indigenous tribes that like we're seeing here in Arizona. And considering like the context that we're in here in Tucson, where we're right near the border. And so those intersecting identities of like Latino youth, but also like queer youth that we're serving. I think we can move forward. So let's see. When I'm thinking about this conversation too, I'm thinking about the context that we're working in here within the pandemic. I know we were speaking to it earlier, and just considering like how I think it didn't expose like anything new. I think it was just really highlighting a lot of the disparities that already exist. And when I'm looking at this slide and like mental wellness, I think a big part of our work within the Now We Only Wellness program and like the youth that we're serving is really addressing like the sense of like hopelessness that often exists for like youth that have been, you know, going through a lot of like traumatic experiences and like violence. And so really, yeah, like I often ask myself, like, how do you help these youth gain a sense of hope? Because a lot of the silencing that they experience, and that a lot of schools and like just other institutions where a lot of the harm like continues to be perpetuated. And so one thing that I found is that how are we giving youth like a seat at the table in terms of like in this context, like what type of sex education that they're receiving, like what type of policies are they seeing like at these schools that they're attending, at these clinics that they're at, and how are we including those voices in these spaces? And a big part of it for me was just like really giving, yeah, like youth a space within this programming. So like and looking at what opportunities can we provide them, because I think that it's not, they need to see themselves reflected in like the curriculums, the activities that we're doing, and representation is often not enough. Like we have to provide like opportunities for youth to like not only bring themselves up, but also just tackling a lot of those barriers that prevent them from like getting involved. And so for me, like that's often looked like hiring youth in, like allowing them to create a lot of the content and curriculum, and like giving them paid like opportunities, because once we start moving into like those critical like pieces, I think is when we can begin to move forward. So those are also things that I'm thinking about, like putting that like policy and a lot of these theories that we're talking about like into practice. And I think a lot of these pieces here, and like when I talk about like cultural humility, is like really like how are we displaying like empathy, like as adults and like as other providers and people in like positions of power. And so I don't know, I just really can't emphasize this enough, because I'm feeling like a lot of what I've seen like since coming back into like in-person programming and like just being physically in person with a lot of these youth and families is like there's a sense of like numbness that's going around. And like there was such a rush after this pandemic to like get back to normal and whatever that means, and going back into like our day-to-day lives. And oftentimes we just get so lost in the day-to-day, and like making sure that we're productive, and like we forget a lot of that pain and that like isolation that's like just carried in the body, and that a lot of these youth are showing up into school and into community spaces with. So with this yeah, this fear of like not being out yet, or like not being in tune with their identity, that's still happening. I'm thinking about like a lot of the tumultuousness that's already occurring in our youth at this age, where they're still trying to figure out who they are, on top of like these other forms of like oppression that they're facing, whether that's like poverty and like racism and sexism and just so many things. And so I think that, yeah, like as adults and like as folks that are like doing this work, is just being cognizant of like how we're showing up, and not being afraid of that vulnerability. Like I often like tell youth too, like I don't have all the answers, like I'm also in this process of like learning from y'all, because these youth continuously show up like trying to like sharing knowledge with me and sharing valuable insight. And so it's a very humbling experience. And so I can't stress that enough, of like taking that time to just talk to them and like having those day-to-day conversations, because I think a lot of us who are doing this work are navigating so much, and it's overwhelming, and we're constantly dealing with like a lack of resources. And so we lose so much of that value of like those small day-to-day interactions of like building community and like intimacy that we often forget about. I think when we're looking at these risk factors too, one thing that I really want to talk about, and it's connected to like the cultural piece, is like how a lot of these issues like substance use, I know that's something that we constantly talk about with our youth, and this homelessness stuff and suicide, and especially within like the Native youth populations that we're working with, like being mindful of like that historical trauma and that ongoing like colonialism that's existing. One thing I do want to share about like this topic and like LGBT communities is that these concepts are like not anything new in a lot of indigenous communities and like communities of color. And because of like that historical trauma and like colonialism, like so many people have been disconnected from those ancestral ways and those traditions. And so that's something that we often try and like tell our youth, that like there's been terms and there's been certain roles that people in Native communities have held for like generations, but that often gets lost when we talk about like sex education and like other youth programs that aren't always like culturally relevant, or don't center those experiences. I think a lot of times, sometimes queer youth of color like tend to like distance themselves from like these spaces because they don't see themselves reflected in that. And so just acknowledging that those experiences of like colonialism and like historical trauma, I know like recently in the news, there was all this stuff coming out of Canada with like the impact of like residential schools and a lot of that history of like sexual abuse and trauma. And so it's no wonder that like a lot of this violence like manifests in these issues where like there is increased use of like substances, there is an increased risk of like suicide and like a lot of reservations and like Native communities. And so making those connections, that a lot of this stuff isn't just happening in a vacuum, like there is like historical remnants of it. I know Dr. Patel. Oh, go ahead. Sorry.
I was going to jump in there a little bit. Dr. Patel, do you have some insight as far as, Monica, I love how you tied that back to the generally oppressed populations that have been in our communities forever, and not that LGBTQ have not been oppressed forever, but it's a new topic in our society. So Dr. Patel, do you have anything to add there?
Yes, no, thank you so much for bringing, circling back. I started off by saying that love is love, right? And being happy and finding that meaning or purpose in your life, it crosses every human being possible. Well, I have to say that it's also the same thing when it comes to trauma and suicidal thoughts. It doesn't impact just one particular person or group of individuals or one community, or because and even substance abuse, because you've gone through some life, like it can impact anybody. And so I encourage two groups of individuals on this call right now. I encourage all of us who are peers to one another, and I encourage the providers out there to ask the difficult questions, and to be very straightforward about it. I train a lot of professionals on suicide risk assessment. And one of the things, even no matter how many years they've been in this field, I have to break down their own barriers to say, I need you to ask the question, do you want to die? Do you want to kill yourself? Have you had thoughts of not living or taking your own life? And I encourage people to not skirt around it. You just have to be straightforward. Because just as much as we've been spending the last hour talking about not creating this non-judgmental situation, if you ask the question of, have you had thoughts of harming yourself or do you want to hurt yourself? I will guarantee you, and research is showing this more and more because we're doing a lot more research on those individuals who attempted to take their life and attempted suicide. And, for one reason or another, they were able to survive it. The words that we use are very important because no human being wants to feel the physical pain of what it's like to take their own life. I pretty much can put my stake in the ground for that. So if you ask them that question, a lot of times I'll say, I don't know, I don't want to hurt myself. But if you even did that one switch and said, do you want to kill yourself? It's almost like a huge brick that's been laying on their chest has been lifted. And secondly, that if somebody has the courage to share that with you, or somebody has the, and this is a very similar conversation I support when it comes to trauma as well, and even substance use. If somebody is willing to share that information, especially to the providers on the call, but even the peers and the family members out there, please, please, please do not rush to put them in a hospital unless they're seriously in a crisis in that moment. Give them some space to share what they need for support and treatment in that moment. That doesn't necessarily have to be going into the hospital. And I know it's a very blanket statement I'm making. And I will say it again, that if somebody needs that care, they should go there. But what I've always spoken about is if somebody had the courage to share with me something of that nature, that they wanted to actually take their life, I stop for a moment and remind them of all the things they did in that day to that very moment to share with me that, and how they had all these opportunities to take their life and yet they didn't. So there are nuggets of that hopelessness that they feel. I try to negate because there's nuggets of being hopeful along the way that brought them in front of me. And I'm not even talking about me being their therapist. I'm talking about me being their friend, me being their cousin, their sibling, whatever the case may be. I encourage us all to stop for a second if somebody says this to you, not rush to do something, and be present in the moment and hear them, because they shared something very significant. And like I said earlier, it is a big brick that was lifted off their chest. So thank you.
And even you say it's a blanket statement, Dr. Patel, but even if you reach that one person that's thinking that, and you've lifted that burden, that's an amazing thing to be doing. So thank you for that. Monica, do you want to continue?
No, I think that that's a really great place to end with, at least for these slides, the suicide risk, and just how there's still so much stigma attached to that. And I think even with the times that we're in, like, and folks being in isolation. So just, I think the more that we're able to bring in that language and reference it more and take away more of that stigma, then I think, folks are just a lot more comfortable with like coming forward and getting the help that they need.
One, that's something else that I always think about is when you ask the question, are you okay? Or is everything okay? Or are you fine? It's almost like you are sort of giving them the feeling that or the experience they should be having. Like, okay, you have to be okay.
You're giving them their answer.
Yeah, versus being a little bit more open-ended and saying, how are you feeling today? Or what can I do to show up for you today? Things like that. I think it's just a different narrative, and opens, I can think, the door for somebody to step in.
I've learned so much from both of you tonight. The key words that I took away: empathy, humility, just like advocating for yourself and being okay with those feelings you're feeling and talking to somebody about that. And I think it's so important for people to understand, in any community, to understand that they should be comfortable with that, or can be comfortable with that if they find the right person to discover those feelings with. So just want to talk a little bit about what All of Us research program is doing. We're trying to represent that diverse community that has not been represented in healthcare research in the past. So next slide, please. I'm just gonna play this little video really quick. This is from two of our participants that have been in our program for a while. So Jade, can we play that? Or Delaney, can we play that video?
In the past, we kind of have not really been focused on, kind of been that invisibilized group.
It does still feel that I'm not visible just due to a lack of knowledge. It's not that transgender people haven't been around for very long. It's just that only recently is the medical community starting to think about us.
As a gay woman, I don't feel that the health industry has enough information.
And so being visible and feeling safe and being listened to should be given and top priority.
I'm really excited for this program to say, hey, no, we're all experiencing these issues. We all need support around these issues.
As a trans person, my experience with the medical community has been frustrating at times, especially like when I attempt to see a doctor for a trans-related medical concern. A lot of times I'm just met with like, we just don't have enough research to understand quite why this is occurring with you.
The lack of data has been a major problem for a number of years. It's really only been in the last 10 years or so that the big health systems, the surveys that go out to people nationwide, have included any questions about sexual orientation, and only a handful of them have any questions about gender identity.
It's just frustrating to be met with like the utter lack of research on people like me because it directly affects my life. If I can contribute to anything that helps change that paradigm, I would like to.
Back in the 1980s when, you know, the AIDS epidemic hit, LGBT people had to like rally for themselves, by themselves. So now that we actually have, you know, the NIH to come in to help us kind of look more closely at our community, it's something that we should definitely take advantage of.
The more that the medical provider and medical community can learn about our experiences, our lives, our families, our struggles, our joys, the better that they can meet our needs.
To have an intentional focus to include a broader community feels good.
All of us is really taking this approach to make it inclusive of as many people as we can.
I think this program is going to be so phenomenally huge because it really is going to hopefully encompass all of us.
And learning about all of us, it totally clicked for me.
We'll have the information from 1 million people, people of color, LGBT people, people from diverse communities, to tell us about themselves.
To get their biological information into the database so that there's more information to work with when trying to develop new ways of treating people.
I want to be a part of a program like the All of Us program that collects this hard data to make decisions in the future and help others.
This is a game changer to have a program like this that really is going to look at the nuances of what we experience.
By enrolling in the All of Us research program, it's you're 1 in a million, and your unique story is like a part of this larger narrative that you might see yourself as just being a small person, but when you have that data amongst so many other stories and other people's health data, I think pictures can emerge and that you can actually contribute, have an impact on the future of the health of our community.
I'm really excited to be a part of this initiative and to start bringing awareness to the various issues in our community.
It's really a much broader call to stand up and be counted. All of us being seen will give us hope.
My hope would be that the All of Us research program would just get people to really be aware and understand that by them being proactive and joining, that it helps other people.
Whatever information that you glean from me helps someone like me or anyone else in the future.
Enroll, get involved.
So as you can see there from a lot of our participants, they understand that diversity is really the focus of this program, including a diverse audience. In the past, that has not been done. So this program really wants to create the largest, most diverse database that has ever been built of this kind. So we're trying to gather, actually now it's more than 1 million because we're hitting that 1 million so fast on our way to that target. Now they're saying more than 1 million people living in the United States to accelerate that the research. And how they accelerate that research is we're going to build this database that researchers can turn to, and they'll already have a big cohort there that they can study. They can study their environmental, their lifestyle, and their biomedical health information. So they have all three of those factors in there that they can understand how all those different factors affect their disease, affect how understand how medications act in different people. So that's the idea of precision medicine. Then they can hopefully create more precise medical approaches to treat individuals, as you heard in that, as you heard in the testimonials. I want to be treated as an individual. So that's the idea of precision medicine, and that is the database we're trying to build with all of us, is to create a diverse database so that they can understand how diseases affect each individual. Next slide, please. So what are the things that we're trying to answer? How is chronic pain, how does it affect different people? Dementia, is it affected differently by your genetics? Is it affected differently by your lifestyle? Or cancer cures, will they work the first time in some people and not in others? We want to avoid that trial and error where we're just, hitting the same treatment in very different types of people with cancer treatments. So we want to understand, is there a very precise medical approach in chemotherapy that will avoid how we're treating each person? Better treatments for diabetes, or potentially avoiding diabetes. Wouldn't that be great if we had that knowledge of how the three factors, that environmental, lifestyle, and biomedical, how do those affect diabetes, and can we prevent diabetes? Can we develop pain medicines that are not addictive? Next slide, please. So what is our promise to the participants? An opportunity to improve the healthcare in future generations. I mean, that's the idea, right? Or the empathy that we talked about, the humility that we're talking about. It might not be here for us right now, but we need to do something for the future generation to advance medicine, right? So we need to take that empathy, we need to take that humility, and we need to be a part of this. A chance to learn about your own health too. So you get everything, if you participate in this program, you get all your health results back. And that's one of the few programs, research programs, that do that. You actually get your genetic return of results. You get your family ancestry back. So if you want to learn about where your family's from, just like 23andMe, you get that back as well. You get access to your own electronic health records, access to your own data. You're ensuring your community is represented, whether you're LGBTQ, whether you're Latino, Hispanic, whether you're African American, whether you're Caucasian, whether you're a woman, a man, you're representing who you are in this program. And then you have a chance to learn about additional research opportunities. So you can say, I want to be a part of other research opportunities. And if you consent to that, then there might be studies that reach out to you and say, hey, we're looking for people exactly like you to research this particular thing. And then the long-term relationship and value to participants will grow over time. We're going to, hopefully in the future, right now in 2023, we're looking to return biomarker or medical return of results. So they'll sequence your genome and return to you. Do you have certain biomarkers in your genes that might make you have a predisposition to having certain diseases? Now, again, you have to consent to receive that, because some people don't want that. They want to donate their stuff, but they don't want to know about that. You don't have to. You have to consent to receive that. In the future, you would also have your pharmacological results. So you could also see, are there certain medications that maybe my body won't metabolize, but somebody else's will? So it's important for us to know that. Again, when we're talking about something like diabetes, I shouldn't be treated the same as somebody else that's very much different than me. So those medical approaches, that's what we're looking at. If they know that about me, if they know how different medications metabolize, I might have a better medical experience. Next slide, please. So just going quickly through this, these are the things that we ask for the participants, or that you need to go through as a participant. So you would enroll, you would consent to being a part of the program, you would share your electronic health record, and consent to sharing that information. You would answer some surveys, so surveys about your family health history, your overall health history, your environment. Right, just recently, we just released a social determinants of health. So a survey about where is it that you live? What neighborhoods do you live in? What's your environment like? And then scientists can see how that affects your health. And keep in mind, all of this information that you're sharing is de-identified with you. So as soon as you enter the program, your name is de-identified with this information. So scientists, the researchers we're talking about later, will never see your name attached to that. I can't say never. They should not ever be able to see that your name is attached to that. Physical measurements, they'll take your blood pressure, they'll take your measurements, and they will give you back your blood pressure, your BMI. You'll provide samples, your blood, your urine, or possibly your saliva. And then some of our participants will wear Fitbits and things like that so that they can share their ongoing activity every day. Next slide, please. So right now in our workbench, there's been over 300,000 participants are already in our workbench that are sharing information, again, de-identified information with our researchers. There's 860 projects that are going on right now that are researching how different things affect our health. So how there's many studies going on LGBT that would affect LGBTQ plus communities or Hispanic Latino communities, how all these different diseases act differently in these different groups. And that's what's being studied right now in the workbench. Next slide, please. So a couple samples of what's happening in the workbench that would be important to the LGBTQ plus community. One of them is cancer survivorship. So as Dr. Patel mentioned earlier, people in the LGBTQ sexual minority groups tend to seek healthcare later. And so that's what's being studied right now is what does that, as somebody being in the LGBTQ community, what does that do to your healthcare risk in cancer? Because you might seek healthcare later or ask the important questions later because you're uncomfortable maybe asking certain questions. Next slide, please. So another study that's going on is talking about gender minorities and how different health conditions affect gender minorities. So that's really something that's pretty cutting edge. It hasn't been studied a lot, as you heard in our testimonial from Adrian, great kid, just like being uncomfortable. Like he's like, they go to the doctor and they're not sure what to do with them because they haven't had that experience. The doctor hasn't had that experience. They haven't had to deal with those issues yet. So this study is trying to understand how that gender diverse population, how different diseases are acting, different alcohol abuse, substance abuse diseases are acting in that community. Next slide, please. So we've moved on to our Q&A session. So if Monica, if Dr. Patel, if you have any comments, questions on the All of Us research program, happy to answer any questions. Otherwise, we can turn to our questions from our participants.
I mean, first off, kudos to all of us to be doing this research. I think, you know, having been in healthcare myself in the public mental health space and in the private sector for the 20 years I've been working in this space, I think the thing I always hear is, you know, targeting a certain patient population or certain population that is being studied, and that's it, and then translating it over to everybody else. And so I encourage the work that you're doing. I encourage people to participate, especially when it comes to the LGBTQA, you know, community, knowing that there are so many variables or distinct things that can be experienced and can impact your mental and medical health care. Secondly, I think I want to emphasize the fact that I started this conversation off by saying you can't figure out what the disparities are if you don't properly identify what are the barriers that are preventing things from happening. And data is the key way. As you guys heard, I'm a CBT therapist, and we're known to collect data to help determine if we're on the right path of whatever we're doing. So I can't emphasize that enough. And also the fact that it does, you know, we live in a society, we live in a government system where getting that information allows us to have enough then support to say we need to provide services that are geared towards this, and here's the data to support it. And I think that's something I've heard many times before is, especially from my other minority groups, is you guys are just using us to fit the quota of doing the research and that's it, and not doing something with the actual data you're collecting. And so kudos to you guys to not only be collecting it, but actually doing something. And the idea that an individual can join the research and get access to this care or the medical record or the information. I mean, I told you guys to make yourselves your best advocate. You can do it because you're getting all this rich information from all of us. So kudos to you.
Thank you. So Dr. Patel, I think our first question while you're unmuted goes to you. Is it okay to leave if I can tell a healthcare provider that I'm visiting is not LGBTQ friendly? Can I just leave?
So, I mean, I obviously said advocate several times. You are going to be your best storyteller. You are your own author of your own life. You are your own advocate at the end of the day. And so, and I always have a very strong pay it forward mentality. So if you can, in a hopefully purposeful, intentional way, and the purpose and the intention should be yours, not necessarily what you think you're going to do to the provider, I'm going to encourage you to share what part of the experience did not support and meet what you needed. Knowing you may not be able to change them, but hopefully it's a part of you owning your own narrative and having that experience. If it's obviously not a safe situation for you to give that feedback, absolutely. You have every right to change. Your primary care physician, your OBGYN, your urologist, your therapist, your psychiatrist, your dentist, I don't care who it is, if they do or say something to you or their team member does that is not in alignment with your values, you have every right to go seek somebody who does.
Thank you. So Monica, this next question is for you. If someone wanted to support their friend or family member that was LGBTQ+ and struggling mentally, what can you do to help them?
I think a big part of it is listening without judgment, or like even trying to like fix the situation. And I think that's something that I've learned too with my own like mental health journey and just in working with the youth. I think a lot of times when we're seeing a loved one struggle, or maybe they are in a very heavy depressive state, or they're contemplating suicide, there's like, or maybe like going through an abusive relationship, there's a tendency to want to fix or like provide solutions. But I think oftentimes it takes a lot of courage and vulnerability for someone to even come forward and like share that they're struggling. So I think the best thing that we can do is listening compassionately without judgment, and just being a person there for them. I think oftentimes folks that are in these positions are feel very alone, or that they don't have any support. And so, yeah, I think just listening, and then when they're ready, or if they do choose to seek help, then we can, ask them, like, would you like for me to come with you to an appointment, or would you like help in like getting resources, or even just like, hey, do you need help with like errands or like stuff like that? So asking them, like, in what ways would they like to be supported instead of just assuming. So that's what I would say in that situation.
So again, feeling that empathetic heart, right? Just reaching out and what would I need if I was in that situation, and really trying to understand that. So Dr. Patel, what are some things people can do at home to help keep our mental state and quality of life high during the pandemic?
Well, I mean, I do think that the mental health and our own personal mental health across human race lives on a spectrum. It doesn't just reside in all or nothing, and it doesn't reside in just you either have a mental health disease or a condition or disorder and nothing. I fundamentally believe it carries it's very fluid and changes how much impacts our lives. And as a result, I try really hard when I do speak about it, whether it's with my clients, with my family, friends, even, presentations such as these, to not necessarily use words such as it's a struggle or it's a deficit in somebody's life, because there is a strong possibility somebody will live with a mental health issue for the remainder of their life. And so I encourage that if you are somebody who ends up identifying yourself or from somebody else's perspective, that there is something that you are currently living with, and it's a mental health issue that you're living with. First off, remember that you are living with it. You are living, and it happens to be a part of who you are. And it's the same way I speak about even somebody who lives with cancer, somebody who lives with diabetes, somebody who lives with, blood pressure issues. It is first and foremost a human, and then everything else. And remember that as yourself, right? If you happen to identify that you needed that you fall into that category. In terms of right now, I mean, I said this earlier and I'll reemphasize it. Social isolation does not mean emotional isolation. So if for some reason you can't, and you're still not comfortable enough to be in that space, to be with others, which is a huge reason why we've had such an increase of individuals saying they're having, difficulties right now with their own mental health, that I would heavily suggest that just think about ways that you can connect with others. And I know there's Zoom fatigue. Trust me, I get it. I'm in it all my time. I also am somebody who has gotten exhausted with just texting all the time too. And actually have now said, listen, I'm calling people because it's just a different experience. Remember to show up for each other. I think that has been really important during this time, that again, if somebody says I'm fine, I'm okay, those are not feelings, sorry. And really listen to them and challenge them to be a little bit more, specific about what they're feeling at that moment. If you recognize that somebody may need that extra, outreach or support. I also emphasize figuring out a way to still maintain some sense of routine in your life, because it's very important. I remember when the pandemic first started, people were like, I don't know how to separate, work and space in my house and my life and all that sort of stuff. And I said, well, then could you still go on a commute somewhere? Like, even if it's around your neighborhood, and you still get yourself dressed up and you get in the car and you listen to NPR, you listen to your favorite jams, and you're driving somewhere, and if you can order a coffee to go and pick it up and then come home, like pretend you're actually doing things that were very important to your routine. I can't emphasize that enough, because most of our routines have changed, and some of us will not be able to do the things we used to do before, but we have to create some sense of routine in our lives.
Thank you. Well, thank you both. Unfortunately, our time is up. So thank you both for being here so much. I appreciate both of your perspectives from very different walks of life, perhaps, but very unique perspectives that really apply to this conversation we're having tonight. So I appreciate it. Next slide, please. So there will be a post-webinar survey that will pop up right after this. If you wouldn't mind filling it out, all those people that are out there, and letting us know how you felt about the webinar so we can improve or do just as great as we did tonight in the future. On Facebook, if you have questions that you want to follow up with on us, you can DM us and we will be happy to answer or connect you in whatever way we can. And if you scan that QR code with your phone, and if you don't know, for older generation like me, you put your camera on and put your phone up to the QR code and it will bring up our website. And we have a page there that is specifically dedicated to the LGBTQ community and what all of us is doing in that community. And that is all for tonight. I appreciate you all joining us. Thank you so much and have a wonderful evening.
Thank you.
Thanks.
Thank you.